Professor Claus Bachert, what is ULANC and what do you think is relevant? If you can describe it short.
Well, I would see it as an initiative which is really timely now, because we have new medications which are actually targeting the upper and the lower airways. For that, we need, of course, to better understand the symptoms of the other side. As an ENT, so to speak, I'm used to ENT or upper airways problems. But of course, at the same time, these patients have a lot of comorbidity. In our study, about more than 1 out of 2 had also lower airway symptoms. And what we need to do is to put this patient, not under 1, but actually 2 specialist guidance to find the best solution for where do we want to go, what do we want to achieve, and how do we achieve this for this individual patient. And that really asks for a good cooperation, a strong cooperation between both the specialties in favor of the patient.
It has also meant that we have that we have been meeting each other.
Yeah.
And is being on our first name. And of course you are Professor Bachert, but you are also Claus. So if I have a problem, or I think I would like to make a study, or I would like to go up and see how Sanna is working in her situation, it's so easy now because we have been working together. And I think that has been very important, that the most important ENT surgeons in Nordic and Europe, Northern Europe, have been meeting the most important pulmonologists from the same area, and we are becoming friends.
It's very much about taking off barriers, which might have been there just because of a lack of knowledge, lack of opportunity to meet, a lack of common strategies to develop. And from a scientific standpoint, it's very clear that very similar mechanisms are responsible for the disease in the upper and lower airways, and that's how we now approach it with the new drugs, specifically in a much better way for the patient as one individual patient.